Salem Hospital is a massive facility, licensed for 494 beds, but caring for more patients than that during the worst days of COVID. Even with 2,000 nurses, it was more than they could handle.
People were fatigued, exhausted. It's been a long 18 months for our staff and our providers and physicians.
That's Sarah Horn, the chief nursing officer. Salem is typically staffed assuming the hospital will have 75 to 80% of its beds full. When the Delta variant sent more than 100 patients to the hospital, it went well over 100% full. Everyone was swamped.
So none of us anticipated that. None of us staffed up for that.
In mid-August, Oregon Governor Kate Brown sent in the National Guard.
Get a quick temperature of you.
Soldiers can still feel the relief.
Oh, I do. They tell me all the time that they're very appreciative of us being here.
They're hard to miss, wearing their military uniforms in a place where white coats and scrubs are the norm. And they're all over the place, from running health screening stations to moving supplies and more. Deep in the basement, in a maze of boxes, Joseph Alvarez from Fairview quickly picks orders.
We've got a requisition order for the emergency department.
But there was an understandable learning curve.
Yeah, when I first came here, I'm not gonna lie, I was kind of confused on how am I supposed to know where everything's at?
Before the Guard arrived, it was a struggle to get all the supplies pouring into the hospital where it was needed, even with staffers working overtime. 9 Guard members pitched in and got it done, including 2 who worked the graveyard shift.
They were real backed up with orders, and us getting here definitely helped them out.
On the 5th floor, Dan Conley, who usually works on jets at Kingsley Field in Klamath Falls, puts other skills to work.
They teach us how to fold laundry pretty extensively in basic training, so this one I feel semi-qualified to do.
He's helped double the number of times nursing closets are restocked, allowing the nurses to keep working on patients instead of looking for supplies. He's in an area that's an overflow for the ICU. COVID patients have ended up here, an eye-opening experience.
When it's serious, how serious it really is. When folks get intubated, what that outlook looks like, and it's not a good one. So it definitely made COVID more real for me.
Back in the basement, food service has benefited as well. The hospital serves up 1,100 food trays a day, many hand-delivered. The staff lost 6 workers who quit when the COVID pandemic began. 7 soldiers, including Tommy Watson, filled the gap.
Food services, may I come in?
Yeah.
Hi there.
Adding the Guard cut the time from order to delivery by 22 minutes.
Thank you so much.
On another floor, Jonathan Osborne, a software developer in his civilian life in Forest Grove, has the job of cleaning rooms after the patients leave.
Some of those come up with high priority, short notice, so as soon as it comes in, you got to rush over and get the room clean, because some of them they have patients already waiting to get in.
While it is still busy, the COVID numbers are going down here and across the state. Salem Hospital had 64 COVID patients Wednesday. That's down from its high of 112. The staff knows Guard members will soon move on, and they will be missed.
Absolutely. They've really become part of our team. So, yeah.
They will not be forgotten.
So having the National Guard here has just been instrumental in terms of our morale. They've offered a sense of protection. They've helped us navigate this crisis. It's been just, quite frankly, overwhelming for all of us.
Pat Dooris, KGW News.